Thank you. Senator Hyde-Smith.
Thank you, Madam Chairman, and thank you both for being here. Secretary Mayorkas, last week we heard from Secretaries Blinken and Austin about their request for emergency supplemental funding. And we are really trying to work hard to ensure that the funding they are requesting will actually help rebuild our own defense industrial base and support the protection of our allies and partners who are currently at war. And I have a really easy question, and it will take less than 5 seconds for you to answer this. Given the large amount of disaster supplemental funding that has been requested for DHS, is it fair to call the situation at the border a disaster? And this is yes or no that should take just 1 or 2 seconds.
No, the disaster is the fact that we have a broken immigration system that we can't seem to fix.
So the situation at the border, you're saying, is not a disaster?
That is correct.
Okay, and of the 240,000 people who received parole in FY23, how many people from China, Haiti, Nicaragua, and Venezuela are denied parole? How many of those were denied parole?
If I may, Senator, the parole program is for Cubans, Haitians, Nicaraguans, and Venezuelans, not individuals from the People's Republic of China. And I would be pleased to provide you with that data, the success and failure rate of applicants for that program. I'd be pleased to provide that with you subsequent to this hearing.
So it's not a blanket?
It is not. It's an individualized application where the supporter, the sponsor, if you will, is vetted and screened, as well as the intended or potential parolee.
And what factors do not meet the threshold for receiving parole?
Oh, for example, if someone presents a public safety threat, if someone presents a national security threat, we would not grant them parole. Those are two very easy examples to cite. We screen and vet because our highest priority is the safety and security of the American people.
Okay, I have a little time left, and of all the discussion, it is clear that the current border policies this administration has in place are failing terribly. You yourself last week said that there is a need for policy changes, and yet the funding requested in this supplemental will do little to secure our border, and instead, it will throw money at sanctuary cities and inflate our asylum problems even further. What this administration has is a policy problem, or perhaps more appropriately, an implementation of the law problem, not a funding problem. Please explain why Congress should provide you with billions more so-called border security funding if you're just going to keep the same failed policies in place.
Senator, I respectfully disagree with the factual premise of your question. I do not think it is a failure of policy. It is the failure of a broken immigration system. It is also the product of an under-resourced, perennially under-resourced department. This supplemental will assist us in further securing the border by adding critically needed additional personnel and technology. And I will share with you that what we are experiencing is an unprecedented level of global migration, and that is also gripping the entire hemisphere.
Yeah, I think we all know that. I have another question here for Secretary Becerra. Staying on the topic of immigration, Mr. Secretary, your department's Office of Refugee Resettlement is acting in defiance of the Hyde Amendment by using taxpayer dollars to transport pregnant, unaccompanied alien girls across state lines to obtain abortion, clearly acting to circumvent pro-life state laws. Secretary Becerra, how many abortions for pregnant migrant girls has the Office of Refugee Resettlement illegally facilitated across state lines over the past year, and what was that cost to taxpayers?
Senator, thank you for the question. I want to assure you that at the Department of Health and Human Services, we comply with the law when it comes to providing health services or making sure Americans have access to the services. we make sure that we follow the laws that have been passed by Congress, including the Hyde Amendment. And so what the services that we provide to those individuals who are within our care through the unaccompanied child program, they will receive health care services, but it's all within compliance within the law.
Okay, if you wish to disagree with me on the legal aspect, let me put it this way. How many abortions for pregnant migrant girls has the Office of Refugee Resettlement facilitated across state lines over the past year, and what was that cost to taxpayers?
So, Senator, we make sure in compliance with the law that if, for example, emergency services are needed for an individual in our care, we would make sure that they provide those services. We also want to make sure that we assist any individual in being able to execute on their rights to have health care services. So
Do
we
you
will
know the
assist.
numbers?
I can try to get back to you on any precise numbers.
Okay, that's what I'm asking for, is just how much did it cost the taxpayers, and how many were there? And
Thank